everyone, my name is Pauline. I'm a physical therapist and you're watching Clinical Sprinkles. Today we're going to be talking about an issue that I had brought up on my Instagram stories. Basically, I was sharing how I was kind of, I guess the word is reluctant to change a patient's plan of care that was seeing another physical therapist. And so I'll share a little bit about what happened and how I dealt with that kind of conflict. So I'm doing this as a resource as to how you can help yourself in a situation that's similar to this, because there will be many times while you're working as a PT where you see another patient, and although you may not see eye to eye on what the treatment plan should look like, how you can navigate that without discrediting the physical therapist that was already seeing that patient. So I'll start off by sharing how it all started. So I'm an outpatient PT. I work at a clinic with one other physical therapist and 2 PT assistants. And so typically when a physical therapist does the initial evaluation, we try to see that patient all the way through and try to not change up the physical therapist too much, because we already have different training backgrounds, and that way the patient gets somewhat continuity of care. The patient can sometimes see the PT assistant, and that's totally fine, but I think it clashes a little bit more easily when it comes to seeing a physical therapist. So the example that I want to bring to light happened just a couple weeks ago. My colleague, the physical therapist, was out on vacation for the week, and so it fell on me to see her patients. And this can happen even when she's in the office. Maybe she's seeing another one of her patients and the other staff are seeing patients, so then I see that patient. So it's not that big of a deal. It shouldn't be that big of a deal. And so this is what I do when it falls down, and this is the case for that. So when I review the charts, I start with the most recent visit. In the assessment, there should be some sort of picture as to what's going on currently with the patient, including their diagnosis, what the plan of care looks like for that patient, and how they responded to last session. If I'm still not getting a clear picture based on the assessment, I also review the objective findings as well. So read the entire note, but usually I jump right to the assessment first, then I go through the subjective, objective measurements, and then try to get a picture. If I'm not getting my answers from there, then I'll go to the last progress note. If not, then go back to the initial evaluation. 95% of the time, I am going all the way back to at least the initial evaluation to see what kind of progress the patient has made. If they've been here for a few months, maybe the initial evaluation is too far back, and it's more beneficial for me to go to the last progress note. And progress notes are done about every month. Once I've done the chart review, I make sure that I highlight the key things, the key goals that we're working on for the patient, whether it's pain, range of motion, if it's range of motion, in what direction, what functional activities are still limited for the patient, is it sitting, standing, walking, bending over, try to get at least 2 or 3 main focuses for my treatment session for them that day. Based on those highlights, I then go to pick up the patient, bring the patient back. So I tell them, this is what I say to them. I say, "Hi, my name is Pauline. I'll be taking care of you today. I'm also a physical therapist. I want to fill you in on what I know of your case so far, and then you can fill any of the gaps." So then I then share the few highlights, the key focuses that I have for the treatment, and then they fill me in on, no, this is what's changed, no, I'd rather work on this today, and so forth. I purposefully try not to change too much of the treatment, especially if it's a follow-up visit. That's including the soft tissue work, joint mobilizations, exercises. I want to give the patient value and change things that are appropriate, and not do mimic the exact treatment session that they got last time. But definitely I don't want to veer too far off or turn the whole treatment plan 180 degrees, because then when the original physical therapist, the primary physical therapist comes back in, she's going to be like, what the freak? Got the subjective from the patient, gave them the focuses, and then I perform the treatment plan based on the agenda that we lay out right from the beginning of the treatment. That's typically how I treat a patient that's not normally mine, but when there are changes, this is the part where it gets sticky for me. So sometimes a patient will reveal to me that they've been having X number of treatment sessions and they feel like they're not getting better. or they feel like they did get better and they plateaued in their progress and they feel a little bit stuck, or they're telling me things like, oh, my exercise program is too long, I actually don't have time to do all of the exercises that are on there, I kind of pick and choose like the 2 of the ones that I like the most to do. So those are already yellow flags for me, because in my thought I was like, okay, well, what can I do in this treatment session today to help them feel successful? How to help them feel like they're getting benefit and value from the session, without discrediting or trying to step on any toes of the other therapist by saying like, oh, I don't know why the heck you're doing exercises like that. That's not going to help you at all. Or, oh, the physical therapist didn't allude to the fact that you're not getting better. Like, I don't want to say anything negative like that. I just want to turn the conversation towards, okay, well, tell me what your focuses are and we'll see if we can address those here today. And again, this is at the beginning of the session. We've already figured out what our focuses are. So then I go into going through the list of the previous session. Okay, well, soft tissue wise, this is what you both worked on last time. Is there any of these that you feel like you're not getting benefit from? Sometimes they actually have an answer, yes or no to this. Sometimes they say, I don't know the difference between the 2. It's up to us as the physical therapist and provider to be able to narrow that down, to try to differentiate what treatment is the most effective for them. Test retest is a very valuable tool. I have a YouTube video on this already. That simplified just means that you test something, you give an intervention, and then you retest it one more time to see if that intervention helped, rather than doing 3 interventions and then retesting and then not knowing which one actually helped. Change is implemented when I hear those yellow flags, and again, I go through the list of what they found to be helpful so far and tweak the things they haven't found helpful so far. And then after we do the treatment, I go over with them, all right, I'm going to let your primary physical therapist know that we made these changes. I'll let them know the reasoning why, and then I want you to work on these until the next time you come in, and let that person know what you thought of it. Maybe it doesn't help you, maybe it does, but if it does, I'll make sure that the physical therapist knows that we have changed something. Because it's very important that you're working with your colleagues day in and day out. You don't want to step on any toes. I don't want to make anyone angry, but at the end of the day, you want to give them, the patient, the best treatment for them. And I know that's the intention of all physical therapists. That's why we're in this field. That's why we go through so much school and blah, blah, blah. But basically, I just want to make very clear that the intention of changing a plan of care, whether that's frequency of how many times someone needs to come in, whether it's I find the diagnosis is a little bit off of where we need to be. Another tricky thing that I've encountered when the patient then asks to work with you instead of the primary PT that they had done the initial evaluation with. So, I do all of the above to support my colleagues. I've let the patient know that I'm going to communicate with that PT of potential changes, how to implement those changes, and then I know it should be a compliment to me. I know that it's very, nice for patients to want/prefer to work with me. But my colleagues need to be supported. They can be taught. They can be maybe, I asked one particular question that opened a door and just maybe I caught them at the right time. It could be so many things. And so I just want to make sure that we redirect patients as much as we can. It's definitely a work conflict that I wish to avoid. And again, it's a compliment to my skills as a provider. But I'd rather all of us working together as a team, and I work really hard to support all of my staff, my PT assistants especially, because the ones that I work with now are brilliant and they're really good at what they do. So this was just like the long elaboration of what I meant by when I felt nervous changing another PT's plan of care. It needs to be done sometimes, and those are the reasons. So I just went through the reasons why something would need to be changed and how I implement those changes and how to still support your colleagues and your staff on if the patient chooses to work with you or stop working with that provider, how to handle that. So I hope this video was helpful. If you learned something, please give this video a thumbs up, and if you like what you saw, please subscribe to my channel so you don't miss out on any future episodes. I think this is a very common topic, and so if you know someone who this would be very helpful for, please share this video with that person. Otherwise, I will catch you on the next video. Thank you so much for your support. You can find me on Instagram at Clinical Sprinkles, and you can also check out my website. I do other things to help pre-PTs, student PTs, and current PTs along the profession. All of my resources are listed on my website, which I will link below. I hope you all have a wonderful day, a wonderful week, and I hope to see you on the next video. Bye!